Hi, it's now almost 4 o'clock on Wednesday, but I wanted to do just a quick video here about the Harlem Children's Zone case study. And sort of what I wanted to just comment on was the parallel between the development of the Harlem Children's Zone comprehensive program model and the hierarchy of evaluations that we've been learning about. In other words, we clearly know that there's a need in Harlem that kids aren't growing up successfully. And if we read on the first page, it said Canada believes that to actively help children from troubled communities grow to healthy adulthood and become responsible, fulfilled members of their community. Okay, that's the need he was trying to meet, and so things follow from that. And to continue that sentence, he basically said two important things had to happen. First, they had to be surrounded by a critical mass of caring adults. That is, the children had to be surrounded by a critical mass of caring children. And second, early in their lives, they must be exposed to sound health care, intellectual and social stimulation, and consistent guidance. Okay, so that was kind of the belief system, but it didn't really translate into programming until they went through a process that actually it kind of starts at the bottom of page 3, where it says, but Canada was frustrated by the whims of foundations that dictated program design through their various initiatives. He dreamed of building the agency based on its potential impact rather than creating new programs and adapting existing ones to accommodate externally perceived needs and available funding. And just the way he's approaching this is different, right? He's not chasing dollars. He's not worried about individual programs so much. He's looking for potential impact as it relates to helping kids get to adulthood healthy and self-sufficient. And so knowing that he has this vision, he then has a business planning process. And it starts with, I'm on page 5 now, and the first thing the business plan did was talk about, it forced, I'm reading now, at the middle there, the business plan, the process of developing the business plan, I'll just read it, I won't try to paraphrase. The process resulted in an ambitious and detailed growth plan based on several key elements. First, it forced Riedlin to explicitly state the theory of change that would undergird the approach. Okay, so this is right. They identified the need, and then they really talked about program theory evaluation. Right, they thought that for a child to reach a healthy, productive adulthood requires programs that provide, in italics, a critical mass of engaged, effective families and early and progressive intervention in children's development. Okay, and then after kind of having this programmatic theory, or this theory of change, a logic model, they then looked at their programs and the program theory, and I thought this was really fascinating. Canada and his senior staff determined that Riedlin needed to align its current programs and add certain programs to its mix to achieve their objectives as stated in the theory of change. Of particular importance were the needs of children in the preschool bracket. To free up managerial and financial resources, Canada made the difficult decision to close 3 successful programs. Is that amazing? I think that's just incredible. He closed a senior center, a dropout prevention center, and a homeless prevention program. Is that amazing? Because the programs were not aligned with the stated theory of change, and so he said, no, we can't do this anymore. I thought that was fabulous. Okay, and then finally, when they decide what programs they need in order to align with the program theory, right, they have all these new programs set up, and then they decided, okay, now we need the data to make sure we're implementing it properly, and then to show impact. And we were having a discussion about that in the other discussion forums. But I just thought that was really interesting, right, that in developing and coming up with what is now the Harlem Children's Zone, he went from need to a guess about what the program theory might be, right, and then aligned programs with the theory, and then went to see how it was being implemented, and then impact. Kind of simple, but courageous at the same time, and visionary, because, right, most of us chase the dollars in order to, and try to cobble programs together that sort of meet our agency's mission, but he was really intentional and narrowed right down onto what he wanted to do in order to have community-wide impact. Okay.